My name is Jennifer Boeding, and I manage the STAR Center at Blank Children's Hospital. At the STAR Center, we provide primary care services in the foster care clinic. It's a specialized clinic serving children who've been removed from their homes and placed with foster families or placed with relatives. We will provide their primary care. We will also provide their mental health therapy and care coordination so that these children, when they're removed from their homes, are getting all of their medical and mental health care needs met at that time. So say a child is removed from their home due to an abuse allegation. They're placed with a foster family. That foster family is able to bring that child into the foster care clinic. We will do a comprehensive assessment. We'll do a physical assessment, developmental assessment, and a trauma and mental health screening for that child to make sure that we're meeting first identifying all of their medical and mental health care needs, and then putting a treatment plan together to meet those needs. So the team at the foster care clinic is made up of a board-certified child abuse pediatrician, a doctor who's been trained to work with children who've experienced trauma. We also have a mental health therapist who's trained in treatment models that work with children who've experienced trauma as well. Rounding out our team right now is a care manager who is able to collect all of the information and work with all of our public and private partners who may be working with the families to make sure that no item is dropped in the treatment of this child. So at Blank Children's STAR Center, we partner with the Department of Human Services on a number of the programs that we provide. They're a huge partner of ours, and we work with them daily on the cases that we see. I can't stress how much the department does for these families. They do a fantastic job, obviously. And then I would probably say that we've seen the DHS recommendation report come out, and we would love to partner with the department to be a part of the solution and work with them to roll out any of those recommendations that may be best for the communities that we serve and the families we serve. So research has shown that when children enter foster care, 80% of them have at least one unmet medical or mental health care need. And the way our system is designed right now, those needs may continue to go unmet unless they're identified, which is partially the reason we open this clinic, so that we can better identify these needs. A child may come into our center and they're having extreme behaviors because of the trauma that they've experienced. So they may be climbing up on the rooftop. They may be getting kicked out of class. They may be fighting with siblings, and it may be escalating. And so they'll come into our center and they'll meet with our pediatrician, who will talk with them. They'll talk with the foster families and the bio parents when appropriate, and educate and support and try and work out where medically we may be able to provide some interventions to help with these behaviors. And then we'll also have the whole family and the child meet with our mental health therapist, who's really going to work on bringing that child down, stabilizing that child so that those behaviors are obviously reduced. And then we're going to educate our foster families and our bio parents so that they understand that these behaviors, it's not the child, it's the trauma. And so if we can address those traumatic events, and if we can stabilize the child is going to have a much better chance at success in having a happy childhood and then a healthy adulthood.